early psychosomatic issues. So in such cases, we have to start communication. Like we have to explain what they are going through and how that can be prevented. So vasomotor instability means like they will go for vaginitis, dyspareunia, urinary symptoms, weight gain, skin and hair changes, genital prolapse, and even psychological issues. Their sexual life is also affected. So, in such cases, proper communication will help them to understand and start treatment. Like treatment in the sense, if they are following like other symptoms, they have to get treated. So, if the stage is second, that is 2A, that is up to 1 year post menopause, or up to 5 years post menopause, the events will be like atrophic changes, late psychosomatic symptoms. They'll be more depressed and they will be more confused. In such cases, the action will be treatment. In third stage, it is little bit severe than the second stage. So there will be ischemic heart disease, osteoporosis change, and even cerebrovascular accidents and Alzheimer's disease are also present. So in such cases, the action will be prevention. So these are the bibliography used for taking that slides. Estrogen. So what is estrogen? So this is the hormone which is playing a lot of roles in women's life, and because of this deficiency, every women are facing a lot of changes in the body. So let's see as a therapist how we are going to help them. First, let us discuss something about estrogen. So what is estrogen? So in females, women's ovaries make most estrogen hormones. Adrenal glands and fat cells also make small amount of hormones. So what's the function? As we all know, it helps to develop and maintain reproductive system and female characteristics such as breast and pubic hair. This is the main function, and it also contributes to cognitive health, bone health, even muscle health, the function of cardiovascular system, and other essential process, bodily process. It also work in brain. So first, let us discuss estrogen and bone metabolism. So how estrogen is linked with bone metabolism? Option. This deficiency is associated with a gap between bone resorption and bone formation, indicating that estrogen is also important for maintaining bone formation. So you can see in menopause what happens, the estrogen deficiency occurs, and because of that oxidative stress is increased, which altered the bone remodeling, which increase bone formation and decreases bone resorption, which end up in osteoporosis. Another side, you can see estrogen deficiency also end up in chronic inflammation, which is again altering the bone remodeling and ending up in osteoporosis. So this is the pathogenesis, how menopause affects the bone and leads to osteoporosis. You can see here, see how estrogen and osteoporosis is directly related. You can see the hormonal levels here. See, at the age of 50, it starts to decline. At the age of 60, it is very least. So what happens here? You can see the healthy bone and the osteoporotic bone. You can see the bone remodeling there. So when estrogen is less, the bone becomes more prone for osteoporosis. So estrogen level decrease in the body, then the breaking down bones is at a faster rate. So low peak bone mass will start from the age of 35 itself. So from age of 35, then bone mass will get reduced. So when the menopause occurs, it will add to a loss of bone mass. So what happens here? You can see here the flow chart. So low peak bone mass will affect the low bone mass, and postmenopausal bone loss will also affect it. Age related bone mass will also affect the low bone mass. There are other risk factors such as rheumatoid arthritis or smoking or alcohol, then diabetes mellitus, which also induce low bone mass, and it will leads to fracture, which is because of fall and low bone mineral density or low bone mass density. Then the bone structure will be architecture will also be affected, which finally end up in low BMD, which is equal to peak bone or bone loss. This bibliography. Then next comes sarcopenia. So sarcopenia, as we all know, sarcopenia is more of age-related disease, right? So what happens here? What happens here in sarcopenia because of estrogen? What does that sarcopenia do? We know that it is important is low loss of fat-free mass or muscle mass, that is called sarcopenia, which occurs along with the increased fat mass. So when the loss of muscle mass is there, it also increase the fat mass. So this results in functional loss in muscles, reduced strength, stamina, stability, and frailty, ultimately leading to in performing daily routine. So decline in muscle mass and strength comparable to loss of bone mass from young adulthood to child old age. So this is what sarcopenia. So we will see how it affects. There are also sarcopenic obesity, that is condition of reduced lean body mass in the context of excess adiposity like I have discussed already. Like even there is a loss of muscle mass, there will be increased fat deposition which leads to sarcopenic obesity. So obesity exacerbates sarcopenia, increases the infiltration of fat into the muscles, that is lowers the physical function and increases the risk of mortality. So when the fat mass get accumulated, there will be the loss of physical function and the mortality chances will be high. So sarcopenia is like it is not only the loss of muscle mass but also the increased fat mass. There are various stages in sarcopenia according to European Working Group of Sarcopenia in older people. They are pre-sarcopenia, sarcopenia stage, and severe sarcopenia. So, what is pre-sarcopenia stage? In this, there will be low muscle mass with no impact on muscle strength or physical performance. Like when we take CT of CT etc., we can see the low muscle mass, but when we check for strength or performance, that will be normal. So that indicates pre-sarcopenia. In sarcopenia stage, there will be low muscle mass with low muscle strength or physical performance. So the muscle mass will also be low, and the strength and physical performance is also affected. So in case of severe, there will be low muscle mass with severe loss of muscle strength or physical performance. So there will be a very significant loss in muscle strength or physical performance. So sarcopenia is divided according to the presentation. You can see here to the left of me, you can see the healthy muscle mass. You can see the bone, which is surrounded by a good flesh of muscle and the fatty tissue that is very thin. But what happens in sarcopenia, that is B, that is the picture B to the right of me, we can see here the muscle mass is reduced whereas the fatty tissue is increased. So we have already discussed like in sarcopenia there will be less or loss of muscle mass and increased fatty tissue. So this picture clearly explains how your muscles will be in the menopause stage, like in sarcopenia, in case of sarcopenia. So how does sorry how does estrogen deficiency ends up in sarcopenia? So loss of muscle mass happens through apoptotic mechanism like programmed cell death. And dynapenia, it is because of myosin dysfunction and the poor formation of satellite cells, which impairs the muscle regeneration. So because of the less number of satellite cells, there is muscle regeneration which is affected, which impacts the force generation. You can see what is apoptosis. It is a programmed cell death. Dynapenia means loss of muscle strength. Satellite cells, which are responsible for muscle tissue regeneration. Since satellite cells are affected, there will be less muscle regeneration, and thereby force is also affected. You can see if we have good estrogens, there will be a good myosin function which preserve the muscle quantity. And here we can see like there are more satellite cells which also preserve the muscle mass. So if they are less, both the functions are affected, which ends up in the loss of muscle mass and strength. Then how to investigate? Let us see. What are the investigation method we are using here? So this is ASTA score. This is for investigating like osteoporosis who are at low risk, high risk, and at risk by measuring BMD. So we use ASTA score. The ASTA formula is body weight minus age into 0.2. Then we use DEXA scan. DEXA scan, DEXA scan is used to know whether they are more prone for fracture or not. So you can see here which comes under normal and osteopenia and osteoporosis. Two-fold increase in fracture indicates osteopenia, and 4 to 5-fold increase in fracture indicates osteoporosis. 20-fold increase in fracture indicates severe osteoporosis. Then we also use FRAX assessment. So this will be of more of questionnaire type like basic age, then date of birth, weight, height, previous history of fracture, uh, previous history of fractured hip, like a parent fractured hip, currently smoking, whether the person is taking glucocorticoids, and rheumatoid, whether he is affected from rheumatoid arthritis or secondary osteoporosis, alcohol intake like more than 3 units per day, and BMD femoral neck can be assessed. So this is more of questionnaire type, which is helpful to determine whether she will be getting fracture in how many years. So for regarding sarcopenia, we use SARC-X score. So this consists of strength, assistance in walking, rise from chair, climb stairs, and falls. So you have to question them like how much difficulty do you have in lifting and carrying 10 pounds. So according to that, you should mark the score. And regarding assistance in walking, how much difficulty do you have walking across a room? So that score will be noted. And rise from a chair, how much difficulty do you have transferring from a chair or bed? Climbing stairs, how much difficulty do you have climbing a flight of 10 stairs? Also, how many times you have fallen in the past year? So all these gives you whether she is affected with sarcopenia or not. And here, and we have a midlife clinic in our hospital. That's what I told you at Arun Hospital. We have a team of doctors. We will be concentrating all those things. Apart from this physiotherapy assessment, we will check out for breast cancers and other things like hot flushes, then vaginitis, dyspareunia, and other parameters like cardiovascular health. Everything will be covered. And this is my department. I have assessment chart like this. You can go through. And this is short physical performance battery sarcopenia screening test. This is shortly called as SPPB test. So what happens here is we are assessing the grip strength for the upper body, So here I have given 19.6 kg, but in hand dynamometer we can change the settings according to the age of the person, which gives you the right value. So you can ask the patient to be seated, make her to sit in comfortable position, and uh, ask her to hold the dynamometer as much as she can and note the value, and you can able to get the average value. So if the value is below the appropriate value, then she might have poor grip strength. Then come side by side stand. Ask them, ask her to stand and hold for 10 seconds with closing eyes. First, do it without closing eyes, then we can do with closed eyes. Then semi-tandem walking, everything should be noted with a timepiece so that we can get the accurate point. Then tandem standing, then length of the walk test course. So you can ask the patient to walk in 4 meters, like we should note the time, how long she's taking to cover the 4 meter of walk. Then chair stand test. First ask the patient whether she can able to rise from chair. If so, can she do it for 5 times? Then proceed with the point. So each and every test should be explained clearly before the patient attempts. You should stand always by near to them, because many of the patients at this age may experience fall or giddiness because of those symptoms, like perimenopausal symptoms. They may experience all those things. So tests should be clearly explained to the patients, and you should always stand nearby them and note the time how they are doing. So this is short physical performance battery, SPPB. So according to that scoring, we will tell like 0 to 3 indicates severe sarcopenia, 4 to 6 indicate moderate sarcopenia, and 7 to 9 indicates mild sarcopenia, and 10 to 12 indicates minimal sarcopenia. So along with SPPB, I also do SARC-F score, which I explained earlier. So exercise prescription will be done according to the assessment and ability of the patient. So this is the algorithm for sarcopenia, like how to find cases, assess, confirm, and how to know the severity. So if you have suspicion, then if there is negative, then you can go for, like if you check for SARC-F score, and if it is negative, then you can go for no sarcopenia, then you can rescreen later, like after an year or something else. If suppose the score is positive, then we should proceed with muscle strength, as I told you, grip strength and chair strength test, which we did in SPPB. And if this is normal, then it also indicates no sarcopenia, then rescreen should be done after an year. If it is low, like grip strength and chair stand test is low, maybe chances of sarcopenia is there. So we should start the assessment and start the intervention. And if the muscle quantity or quality is less, then we should proceed with, where we should confirm that sarcopenia is confirmed. If it is normal, we should start the prevention mechanism. So if it is confirmed, we should do other tests like 400 meters walk test, gait speed test, SPBB test, etc. So if it is low, then it indicates is severe sarcopenia. So what here is, if you don't use, you will lose. So even though we are working with the 70 years old women or 90 years old women, still there are chances we shall work on increasing the muscle mass. So keep it in mind. If you don't use, you will lose. Then exercise and menopause. How does exercise helps in managing menopause? That should be started during perimenopause period itself. So perimenopausal women who are more active physically and gain weight less have lower elevations of LDL, total cholesterol, and triglycerides. So it is mandatory, like women should start doing physical activity at perimenopausal stage itself to prevent weight loss, to prevent weight gain, and also to lower elevations of low density lipoprotein and total cholesterol and triglycerides and hot flushes. Many of the women getting in our OPD, usually say like they get hot flushes in the middle of the night, and even when they are okay, when they are in AC room itself, they can feel the hot flushes, and suddenly they think of like they have a heart problem. That's why they are getting that things, and which will physiologically and psychologically affect the status of the women. So exercise increases the level of estrogen and decreases the severity of hot flushes. So aerobic, especially aerobic exercise works wonder in reducing the hot flushes when mood changes. So already I have mentioned like vasomotor changes in menopausal and perimenopausal women. So what happens like they will be going for more of stress and depression. So exercise help them to decrease stress and depression. Stress and urinary incontinence. So estrogen deficiency leads to atrophy of urethral epithelium and loss of compliance. Skeletal muscle mass reduction at external sphincter. So we have seen many impact of estrogen deficiency in skeletal mass in before slides. So it also affect the skeletal mass at the bladder. So what happens is because of that muscle atrophy, there will be loss of muscle. There will be weak muscles around the bladder, that is external sphincter area, which leads to stress and urge incontinence in the women. So what we will do as a physiotherapist here, we will assess like what's the power and how can we proceed them, and we will collect the detailed history, and we will train them like pelvic floor muscle training will be given, and we will ask them to maintain bladder diary, and we'll ask them to maintain good posture and the use of proper muscle technique while lifting and unloading the weight. So such things will definitely help them to overcome this urinary incontinence. And also many people will face valvodynia and dyspareunia. So physiotherapy plays a key role in getting less like their pain or reduced to least along with the hormone therapy or along with the tablets. So physiotherapy plays a main role in stress and urge incontinence, and also in the cases of spastic muscles like vaginismus or valvodynia or interstitial cystitis, etc. So how can we measure the physical activity? So how we can measure the physical activity in case of doing exercise? So talk test. What happens in talk test? So we should ask the patient to talk. So one should be able to sing while doing the activity. So at moderate intensity level, one should be able to carry on a conversation comfortably while engaging in the activity. If the person becomes winded or too out of breath to carry on conversation, then the activity can be considered as vigorous. So this is one of the tests, talk test. And second test is targeted heart rate test and estimated maximum heart rate. See, for example, like for a 50-year-old person, the estimated maximum age-related heart rate would be calculated as 220 minus 50. So the answer will be 170 beats per minute, and that should be multiplied to 50 percentage, and which we get like 85 beats per minute. And if it is 70 percentage, and the answer will be 190 beats per minute. So the range should be between 85 per minute and 119 per minute for that particular person. So that is the proper suggestion of exercise would be like the heart rate should be between 85 to 119. Then we have Borg RBE scale. So that means Borg rating of perceived exertion. So while doing physical activity, one should rate one's perception of exertion. This feeling should reflect how heavy and strenuous the exercise feels to the person, combining all sensations and feelings of physical stress, effort, and fatigue. One should not concern oneself with any other factors such as leg pain or shortness of breath, but try to focus on total feeling of exertion. If the range rating scale falls between 6 to 20, where 6 means no exertion at all and 20 means maximal exertion. So through this calculation, we can measure the physical activity intensity, and also we can measure through metabolic equivalent level. So 1 met is equal to the energy used by the body as you sit quietly, maybe while talking on the phone or reading a book, etc. So any activity that burns between 3 to 6 minutes is considered as moderate intensity, which burns more than 6 minutes is considered to be vigorous intensity physical activity. Then contraindications for doing exercises or myocardial infarction, uncontrolled arrhythmia, unstable angina, third degree block, acute progressive heart failure, elevated blood pressure, cardiomyopathy, valvular heart disease, uncontrolled metabolic diseases. So, how the exercise prescription should be? It should be according to the patient's muscle mass and strength to increase the endurance. So, cardiovascular conditioning should also be added to the exercise prescription, like brisk walking, running, jogging, cycling, swimming, or stair climbing. Then, regarding exercise prescription, what we can do is it should cover endurance, strength. Sorry, ma'am.
Nothing, ma'am. Carry on, ma'am.
Okay.
Okay.
So regarding exercise prescription, it should cover all those things like endurance, strength, balance, etc. So we must know like weight bearing and resistant exercise are very important in increasing the bone mineral density of the spine in peri and postmenopausal women. So we should prescribe exercise in such a way that should increase the bone mineral BMD of the spine or BMD of the other bones. So aerobic training can also be done to relieve the psychological stress. It can be done in group therapy. So first, the main aim is motivation. So if we ask the patient to start resistance exercise, so without the motivation, she may be unable to do. So main aim is motivation here. So aerobic training with the group therapy will be the good motivation for a women to start with the exercise, and it is very easy to achieve the goal. And it also improves the stretching and strengthening of muscles. Usually the session lasts for 45 to 50 minutes. What is the benefits of doing that? So it improves endurance, it improves sleep, it helps in maintaining weight, it reduces stress, depression, anxiety. So the aerobic exercise plays a main role in reduction of psychological issues and resistance training. So this is the must training for the perimenopausal women. So since we have seen the loss of BMD and the loss of muscle mass, so the only thing which is going to help here is resistance training, which is a major part in perimenopause and menopause. So we always know like prevention is better than cure. It is better to start the resistance program at the perimenopausal age, that is from 40 to 50, which is the golden period of every woman, because the estrogen deficiency will drastically come down after 50. So it is better to start doing all those exercise from the age of 40. If suppose women gets early menopause or surgical menopause from the age of 30 or 35, she should start by little bit earlier. So as we have already seen, like peak bone mass starts from the age of 30 itself. So it is better to start from there. If you have not done, at least start from the age of 40. That is from the perimenopausal stage. So how the resistance training can be given? It can be given through TheraBand or with weights. For upper limb, we can start with band exercise, pulley, or shoulder rehab wheel, etc. For lower limb, we can start with Q-table strengthening for quadriceps and hamstrings, static cycling, and pedocycle. What happens here in case of arthritis, when we give resistant exercise, it builds muscle which indirectly absorbs the shock, and it protects the joint from injury. In case of sarcopenia, strengthening exercise decreases the fat, which we have seen already. in sarcopenia, we see like loss of muscle mass will be there and increased fat deposition will be there. So in sarcopenia, strengthening exercise help to decrease fat and increase the muscle mass. So we have discussed like it improves strength, endurance, fat-free mass, and it also increases bone mineral density. So to increase muscular strength, we should use heavy weights with low repetitions. To increase muscular endurance, we should use low weights with more repetitions. We can start training with the weights with minimum of zero point 0.5 kg, and we shall progress it to 1 kg, 2 kg, 5 kg. So weight can be used as like dumbbells or weight cuffs. In case of weight cuffs, we can be tied on ankle or at wrist. Repetition should be like 10 reps, holding for 10 seconds with 2 sets once a day. So progressively increasing the weight should be definitely reassessed by the therapist. Only then the patient has to proceed with the increase in weight. Then weight bearing and aerobic training helps in bone metabolism. And in case of sarcopenia, strength training is the only way. As I told you, because of estrogen deficiency, there will be sheer loss of muscle mass. So the strength training is the only way to prevent or overcome sarcopenia. So if sarcopenia is prevented, then fall will be prevented, then balance will be prevented, thereby fractures can be prevented or minimized. How much exercise do we need? So for fitness and reduced chronic disease risk, we should exercise at least 30 minutes per day. To reduce chronic disease risk, we should do 60 minutes per day. For prevention of weight gain, we should do 90 minutes per day. And like weekly, three times, like weekly thrice strengthening should be added, and other 2 days can be more of say a cardiovascular conditioning program or like aerobic exercise or more of yoga like that. So in case of if you are suggesting for Surya Namaskar, so how many times can be done? So 15 times can be done for 35 years and below, 10 times for 36 to 50 years, and 6 times for 50 years and above. So alternate, for example, you can fix it as for Monday, Wednesday, Friday, you can give more of strength training, resistance training. And the other days, Tuesday and Thursday, you can go for more of stretching and cardiovascular conditioning and aerobic mode of exercises. So this is a global recommendation. So 30 minutes or more of moderate physical activity on most preferably all days, but we shall for many of the women all days is not at all possible. At least 5 times a day, sorry, 5 times a week is appreciable. So weight bearing such as walking, brisk walking is mandatory here. Then strength training 2 to 3 times per week. Balance training can be incorporated along with strength training or along with aerobic training to prevent falls. So this is the citations I have used here. End of this slide. And thank you so much.
Thank you, dear ma'am, for the very wonderful sessions. And ma'am, we have certain doubts
Yeah, sure.
asked by the participants. Uh, First doubt is by Dr. Susan ma'am. That is the Frog's assessment scale and other scales that ma'am has specified about. So can we use that scale in any studies? Whether it have what about its reliability and validity?
See, it's actually frac scale is used in quietly in India. Most probably, it's more of questionnaire type, so it is very easy to use. So we have studies like frax is acceptable all over the like in India. So it is used more in Indian Menopausal Society. So frax is acceptable thing. We can do it.
Okay, ma'am.
So we are
Hope,
doing it in our hospital too.
okay, ma'am. Hope Susan ma'am, your doubt is clear. Then,
Yes, ma'am. That prevalence all we can find from this using this scale, no?
Yes, yes, of course.
okay,
Thank you.
okay, ma'am. Then our next doubt is asked by Sindhu ma'am. That is, ma'am had specified about the bone resorption and bone formation. Depends on the estrogen level in females. Then what about in case of males?
See, it also like sarcopenia is little bit then it is more less than the it is more less than the females, because when estrogen is more, the bone resorption and absorption will not be affected. Whereas in case of menopause and perimenopause, there will be very less. Even men's will be affected, but not at that age, since they have good they are also producing testosterone and other hormones and all, so that will be more. So their sarcopenic changes will be little bit higher, like they will be starting by age of 60 or 70. But according for women, then since estrogen deficiency starts to decline from age of 50, it is more common in females. Even men is also affected, but not in that age. They may go up to like after 50 or 60 something.
Okay, thank you, ma'am. Hope Sindhu ma'am's doubt is cleared. And next doubt is from Muthupandi sir. That is, do you have any dietary suggestions on perimenopausal woman? If so, then kindly.
Yeah, yeah, of course, sir. So in India, there is a lot of study indicating that poor nutritional status, because now no one is concentrating on vitamins intake. So it is mandatory, like dietary indication is also important for perimenopausal and menopausal women. So a good diet will help to overcome the osteoporosis and also the sarcopenic changes.
Okay,
So if
thank
the
you, ma'am.
woman is not taking enough nutrients and then on, then she should be taking supplements or something else to meet out those changes.
Okay, thank you, ma'am. Ma'am, our next doubt is from Mohana Vidya, ma'am. That is, ma'am, can you throw some light on the aspects of hormone replacement therapy?
See, actually, now still now there is a conflict behind hormone replacement therapy. But actually, I have attended many seminars on Indian Menopausal Society. So what they say is, so only if the person is needed, we can start hormone replacement therapy, and it should not be instructed for all the patients who is not in need, which may end up in severe complications. So first set of treatment will be dietary changes, lifestyle modification, exercise prescription, and even after that the patient is not responding or the things are not changing, there comes the hormone replacement therapy. But when hormone replacement therapy and exercise are done together for the needy patients, the results are awesome.
Okay, thank you, ma'am. And we don't have any other doubts. Uh, and a special thanks to Susan, ma'am.
Ma'am, one more.
Okay.
Yeah. Ma'am, can you talk about the early menopause? Because nowadays, no, 30 to 35 range, the women also getting, menopause. I have
Yeah, yeah.
seen few cases like that. So I was actually got wondered how this much early menopause is happening. Some females are not have given birth to kids also. So this is big issues nowadays. Is this because of a lifestyle changes or related to the hormones only?
So it can be occurred because of both of these, and something like more women are experiencing all those things because of lifestyle changes and lots of PCOD issues. Many women are facing PCOD issues, and because of hormones problem, also they are getting early menopause. Mostly they are getting surgical menopause. Hope you have heard that. So even at the time of delivery, at the time of emergency, like during case of PPH, there is no option, so that uterus has to be removed. So the women can get early menopause. And apart from surgically removed menopause, the earlier menopause is due to more of lifestyle rather than the hormone, because of the food we intake and lack of physical activity, etc.
Okay, ma'am. Okay, thank you, thank you. Ma'am, anywhere in India, this course is available, lactation course, which you have done?
Yeah, yeah. Actually, I did in both in India and also in California. Like in India, there is a course called IYCF, Infant Young Child Feeding Course, that is conducted by BPNI. Usually, they conduct like once in 3 months. and it will be all over India. Like they will have a batch at Pondicherry at once or Delhi at once or something else. You should regularly check their website to know the what for more details. There will be one week residential program, so clinical and then theory part will be covered where you will be examining the patients and also the theory part will be there. We can do it in India.
Okay, ma'am. Thank you so much.
So being a therapist, and once we do that course, and if we have clinical setup practice, we can apply for IBCLC, like International Board of Lactation Consultant. And we should, if we go through that exam, then we will be like International Board of Lactation Consultant.
Okay.
So nowadays, more physios are doing that. Even I am so much, very much interested in doing that because it is very unaddressed area, like a menopause too. So many of the therapists will not concentrate on perimenopause or menopause women. Only we do concentrate on pain management, etc. But it is essential for every therapist to concentrate on perimenopause women to prevent complications. And regarding lactation, many mothers are facing that issues. So it will be very well like if we physios do that instead of people who's from non-medical background. It will be very much interested if we do that because we know the anatomy and physiology behind that. So we will help the patients a lot rather than them.
We are
Thank you so
looking
much.
forward for another class from you on that topic, ma'am.
Yeah, yeah, sure, sure. Yeah, I'm ready. Actually, I'm very much interested because I've seen a lot of patients with those difficulties, and once we help them, it's more than money. Like it's not a money; it gives complete soul satisfaction when both mother and baby gets satisfied.
Thank you, ma'am.
So thank you so much, ma'am,
Thank you, sir.
and for showing throwing some light in the unaddressed aspects, many things. And I am remembering our 2019 physiotherapy day theme was chronic pain, and it was addressed that movement for health. So yeah, so lack of movement is the cause of many aspects, right, ma'am? Even in the hormonal changes as well as osteoporotic or any aspects. So ma'am also today specified about if you don't use you will lose.
Yeah, yeah, of course.
So that will be a take home message. And I hope all the participants enjoyed the sessions, and I'm 100% sure that got new ideas about treatment and management of such aspects. We thank you, ma'am, for sharing your valuable time with us and for sharing the important knowledge. Thank you, ma'am.
Thank you, sir. Thank you so much for giving me this wonderful opportunity, and my special thanks to Dr. Sushen, uh, who have given me this opportunity to show, as I said, to show me the interest, to show the unaddressed area known by the every therapist. So this has to be addressed, and thank you so much.
Thank you, ma'am.
Thank you, sir. Thank you.
Thank you, all dear participants. And remember about our
Kind
tomorrow's.
request to the participants, don't leave the webinar group because we will be sharing one feedback form.
Dear participants, after filling the feedback form only, you can leave the sessions. And also remember about our tomorrow's and day after tomorrow's sessions also. Thank you.